The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 In Focus.
Hello, I'm Susan Shapiro. First responders are usually the first on the scene to face challenging and often dangerous situations. Studies estimate that 30% of first responders develop behavioral health conditions compared with 20% in the general population. Tonight, we'll talk with first responders from the Susquehanna Valley and a counselor from Penn Medicine Lancaster General Health as we put first responder mental health in focus. Joining me now, Ben Herskowitz, who's the chief of Lancaster Hazmat, and Sergeant Alex Borton, who's with the Hempfield Fire Department. Thanks to both of you for being here.
Our pleasure.
Thanks for having us.
Ben, I'll start with you. How difficult is this job in terms of your mental health, what you do?
It can be very stressful. Most people, when they think of first responder mental health, they think of PTSD. They think of, oh man, they must see some horrible stuff. And the reality is that the mental health aspect of it starts long before that. It's a stressful job, but everybody is human, especially since a majority of the responders in this county are volunteer. They're trying to balance work and home, and then we put in this extra activity. And so, big fan of Maslow's hierarchy of needs, and so shelter, that basic human need, is difficult. So we have a lot of personnel who stress about, how they're going to find a place to live because the housing market is tight, and then afford it. I know growing up, my father worked basically one job. Mom stayed at home to raise us. That is not the norm anymore. And so people try to balance all that. And if you have some club that you're a member of and you say, man, I'm not going to go to that club today because I have something I need to take care of in my personal life, you think to yourself, well, I'll just go to the next meeting. Where when you're dealing with emergency response, some people feel a level of guilt if they don't go and provide that assistance, because if they don't go, who will? And they're not going means that somebody's worst day goes either unanswered or less answered.
That's interesting.
And so that builds up, and it's just one more stress. And it's a lot to balance, because if you want to go learn to play chess, well, you just go learn to play chess. Yes, there's complexities, and it's enjoyable, and what we do is enjoyable, but there's a lot more training involved, and if I forget which way the bishop moves, it's not a big deal, someone will correct me. If I forget which way to do something in the fire service, it could injure or kill me, my coworkers, or even the public. And so that stress is very cumulative, and that kind of sets the stage for some of these big life-altering events that people see or experience that kind of just is the complete package.
So you're doing a stressful job, Alex, still with the stress of life and everything else going on.
Ben hit the nail on the head. It is cumulative, and part of the training experience for new people in the fire service that I particularly like to focus on is helping people understand that there's an onion model to helping them have the resources they need to compartmentalize, digest it in a healthy fashion, and continue to be functional in their personal lives and their professional in the fire service. The onion model, on the outside we have the papery layer. That kind of mentally corresponds to the policies, the paper procedures to prevent any kind of shortcoming in teasing or any kind of harassment. There's policy on the outside. We go in a layer, and then there's training. That's starting to get a little bit softer. That's, here's what you do on this call. Here's how we debrief after these calls. And then we move in another layer. We're getting a little softer here. We need to really be what I like to call supervisory cognizance. You need to not only know if your crew members are fit for duty, but you need to be a little bit of a friend to them too. You need to be perceptive of changes in them after a traumatic call, or even something in their personal life that's traumatic, that's carrying through.
Is mental health part of the training?
Mental health is part of the training, especially awareness of the resources that are available to them as coming to a superior, coming to a counselor that is fully funded by the department, the access to the resources they need for their mental health is absolutely part of the training curriculum.
Yeah, and more about talking about it now. Well, we're going to talk more about the stigma surrounding mental health and some of the things you are doing to help some of your coworkers. That's when we come back.
This is WGAL 8 in Focus, coverage you can count on.
We continue our conversation with two first responders, Ben Herskowitz of Lancaster Hazmat and Sergeant Alex Borton with the Hempfield Fire Department. We recently in Lancaster County had a former Lancaster City police officer commit suicide. Does that hit home when you hear something like that?
It does. We have, unfortunately, a higher rate of suicide within emergency services. And it's a shame because it's at a time when I think there are more options to seek help, but there's still stigmas that surround it. There's concerns that people say, well, if I get labeled this, what does it mean for my future? What can I do or not do? What will people think of me? And then one of the other stigmas is as the world changes, first to admit, one of the biggest crutches that we use, or maybe crutch isn't the right word, is dark humor. And society has changed a little bit, and people go, well, you can't joke about certain things. Mm-hmm. And it's easy to say you can't joke about those things when you're not the one experiencing them. And, you know, Oscar Wilde once said that life is too important to be taken seriously. And I think there's some truth to that. And so I look at that in any situation, people have ultimately two choices. They can laugh about it or they can cry about it. And I further tease that if your basement's flooding and you're crying about it, you're only making the situation worse.
Oh, jeez.
but that is an important out, and that people can express their emotions, because otherwise, if they're not crying or they're not laughing, what they're doing is bottling that up. And so now I don't know how you're handling it because I don't know anything about it. And sometimes trying to pry isn't necessarily the best approach either. And so having an environment when people are open and talking about it, and so if guys make ill-timed or dark humor, like, that's
a way of coping.
That's
right?
a way of coping, and B, I get a little view into how your mental health is, because the problem is that's a hands-on approach. I mean, I'm very appreciative to all the people that say, hey, who are my six, or, you know, I have your back, or all this stuff, but the reality is that actions will always mean more than words. And so it's that reaching out and not making a stigma. If a guy's joking about it because he's having trouble, in my opinion, the worst thing we can do is, is stop that communication, because once that communication stops and they bottle it up, we have no idea what's going on. And certainly there are people who can joke about it and be talking about it and still having a problem.
Sure. Yeah. As you said, you need to kind of be able to recognize when that's happening.
Absolutely. Using people's off-the-cuff and more candid reactions to more traumatic events definitely is a very telling window into how they're processing it in a healthy way. Maybe they're not sure how, and that is where the training should kick in, and it should bring them back to the top. Let me talk to my officers. Let me talk to my training officers. Let me open up to someone else on my crew that may then inspire me to talk to an officer. That is part of the cycle, is that you almost need to Pavlov reward the crewmates into providing assistance when they see their friends struggling, and not just remove the stigma, but reward that kind of constructive behavior.
I mean, for coming forward and talking about it, right?
Having your crewmates back, literally, in the sense that you are their beacon. They feel the comfort to open up to you, and furthermore, they reinforce that, bringing it to your superiors so they can get you on the path for whatever kind of help you need.
And I imagine you want to make sure they're okay because they have to go on the next emergency.
Fitness for duty this is all linked together. If they're thinking about, as Ben said, where their head's going that night, if they're thinking about something that happened 3 calls ago, they're not in the moment and they're not performing at their best.
Yeah, which can be dire.
Absolutely. And part of that stigma is, again, like I said, action. We always say, like, if you see something, say something. Well, in this case, that's not enough. If you see something, say something and do something. We've gotten into this, I don't think that would ever happen. They wouldn't do that. And it's like, well, if they made a comment that you don't understand or you interpreted as threatening, not necessarily to like they're going to beat somebody up, but threatening to themselves, you know, it's not enough to just say, oh, hey, well, is that,
are you serious?
Are you serious? Yeah. Like, you need to take it to that, you know, to the next, whatever that appropriate step is, and actually reach out genuinely. And a lot of times we get so calloused about stuff, it almost becomes a joke. Like, someone makes a comment, and so on a half joking, so someone makes a half joking comment back, but like, oh yeah, but you'd never never do it. And they go, yeah, just kidding. But the reality is that conversation happened, and so it's figuring out what is that appropriate action. I mean, you know, you have to have the right tools, and that's the other problem is we have some basic training in it, but without more in-depth training, you know, we say, well, we have an EAP program, you can go talk to a counselor. Yeah. Well, right, well, if that's a hammer, well, then everything's going to look like a nail.
Right.
And if you're like, oh, well, we have this, or we're going to go do whatever event. And the other piece is we spend a lot of time, so much time focusing on training and the actual emergency. We sometimes don't spend enough time on morale and just getting people together to relax and feed those other basic human needs.
Okay. Good point. Well, thank you both for sharing. And we're going to talk more about where people can go for help and what kind of help that is. We'll talk with a counselor coming up.
This is WGAL 8 in Focus, coverage you can count on.
I'm joined now by Ketra Forey, who's the manager of behavioral health at Penn Medicine Lancaster General Health and a certified counselor. Thanks so much for being here.
Absolutely. Thank you for having me.
How are first responders impacted in terms of mental health?
So our first responders are impacted greatly by behavioral health concerns. And so if we think about our first responders, you know, each day they're putting on that uniform and their job is to go and respond to horrific types of incidents that individuals are struggling with. They're seeing people on their absolute worst days. And so over time, you know, that is going to take a toll on a person regardless of the types of coping skills or supports that they may have. And unfortunately, it is, in a sense, the nature of the work. There isn't a whole lot of research that is out there that has been done to really document and show why our first responders struggle so much more with behavioral health concerns than other types of helping professions, like individuals like nurses or doctors working in the emergency department or other type of high stress jobs. But so what the research does show that we do have is that there's a multitude of factors that likely is impacting that. And so they're different. So some are due to just the regular and horrific trauma that our first responders are seeing on a daily basis. It could be the chronic and brief stress that they're exposed to each day when they're on their shifts, the organizational demands, the shift work, working long hours, not really having a time to brief
kind
after
of
an event, decompress, a lack of pay, a lack of benefits, and even just a lack of recognition. I think back to when COVID first started and we would see all of these signs for healthcare heroes work here throughout the hospital, but where was that for our first responders? I think sometimes that they are a forgotten piece of the profession. And then not only are the demands of the job great as well, but our first responders are more likely to suffer from some physical health impairments as well, like insomnia, chronic headaches, chronic pain from injury, weight gain, and probably all of these things factored together has just created a perfect storm, in essence, for our first responders and their behavioral health concerns.
Maybe the job by nature makes it more difficult to take care of yourself?
I think so. And research really supports that as well. So although there isn't too much research out there on first responders specifically with their mental health, as well as specific types of first responders, so where is the data for our EMTs versus our paramedics versus our firefighters, what have you. First responders tend to kind of be lumped together in the research that is done. But the research that we do have, you know, it paints a picture for us, and that picture shows us that our first responders are really struggling with their behavioral health. Research shows that almost 45% of first responders screen positive for a diagnosable behavioral health disorder, which is 4 times higher than the general population. And up to 85% do endorse some some type of mental health concern or issue. It may not be a diagnosable disorder, but it's still causing them distress.
What kind of disorders are we talking about?
So it could be a variety, but likely we see depression, anxiety. A more significant disorder could be PTSD or post-traumatic stress disorder. We see things like substance use. Perhaps an individual is using alcohol or drugs to try and cope with how they're feeling and what's going on. But it can really be anything and everything.
We've seen first responders in our area who have committed suicide or taken their own lives. Is there a higher percentage of that in the first responder community?
There is, unfortunately. So with our EMS providers, they are 1.4 times more likely to die by suicide than the general population. For our EMTs, 1 in 20 EMT deaths are suicide, and our EMS providers have a 10-fold increased likelihood of struggling with suicidal thoughts or even a suicide attempt.
Wow. That's some pretty high numbers, that's
It
for
is.
sure. Well, Ketra, stay with us. We'll talk more about how people might know that they're in crisis and what kind of treatment's available.
Great, thank you.
This is WGAL 8 in Focus, coverage you can count on.
We continue our conversation with Ketra Forey, the manager of behavioral health at Penn Medicine Lancaster General Health, and a counselor who has helped many first responders. How would a first responder know they might need to seek help?
So a first responder could really cue into what their body and their mind and their emotions are almost telling them. So do they find themselves snapping more at the people close to them? Are they struggling to sleep at night? Do they feel like they can't turn their mind off and they're just maybe reliving or thinking about some of those difficult cases that they have worked with? Has it come to a point where it's affecting their life? Perhaps they're having difficulty just getting out of bed on the days that they aren't working. Maybe they're calling out for their scheduled shifts. Perhaps they're even eating more, eating less. Maybe they're increasing alcohol use on the shifts that they're not working. It could really be a multitude of ways in which our bodies and our minds could tell us that something is off and we need to get help.
There's definitely a body-mind connection,
Absolutely.
that's for sure. These are people who are so used to helping others. Do you find that they find it difficult to reach out for help?
Absolutely. So research actually shows that 81% of first responders who are struggling with either a diagnosed mental health disorder or just a concern or distress actually are not seeking treatment, or if they are seeking treatment, they're not asking for a higher frequency of treatment or more help if that's kind of not meeting their need. And so what it really comes down to for our first responders typically are barriers to care and then a stigma. So in regards to the barriers to care, a lot of that boils down to organizational support for them. And their perception is that there is a lack of support for them. Over 50% feel as though if they would go to their supervisor with their concerns that they have and ask for help, that not only could they be deemed not fit for duty, but it could impede career advancement. They feel as though others at work may look or treat them differently, including their supervisor. And not only that, but then just some of the more traditional barriers as well. Just how are you going to schedule an appointment if you're working 4 12-hour shifts or 4 16-hour shifts during the week, and then you're sleeping on your off days to catch up so you can be ready the next day. Perhaps you don't have the money for a copay to be able to go and see a counselor or a psychiatrist or whatever type of treatment that you need. You may not actually have behavioral health benefits that could help cover that out-of-pocket expense for you. And then in addition, when we think of stigma as well, a lot of first responders also are concerned that they'll be considered weak by other individuals for
and
seeking
then how are they
that
going to
help?
help others if they're considered weak? Yeah.
Exactly.
I know the first responders who were on earlier talked about this being part of their training. How much should training focus on the mental health component?
I think it's essential for the training to focus on that. Not only does the training for our first responders need to include opportunities for self-care, but also just for the area in which they're working, what type of help is out there and how can you access it? Not only that, but I think from an organizational stance as well, for our different companies to be able to provide more internal resources and support, more prevention strategies for these folks, knowing that these behavioral health concerns are going to happen with our first responders. So what can we do to try and get ahead of it? Instead of waiting until we're at a crisis point where someone may need to be hospitalized or even attempt or think about suicide, what can we do on the front end so we can try and prevent individuals from getting to that low of a place that they feel that there's no other option out there for them?
Any good tips for, as you say, on that front end for a first responder?
Yeah, I think there are a lot of different things that can be done for our first responders. So the first, I think, is just trying to cue in to your own body. What's going on in you? That would be the first thing, because how can you ask for help if you don't even know that you need it? And then I think the next piece is to be able to actually ask for help, whether that be contacting your insurance company. Maybe it's connecting with your primary care provider. Lots of primary care providers now actually offer counseling services in the office. Not only does Lancaster General offer that, but Penn Medicine offers that, WellSpan, UPMC, Geisinger. There are lots of options that are out there that could be available to connect people to resources. Here in this area, in Lancaster County, Mental Health of America, or MHA, is a great resource to start with. They actually have a grant program called CMAP that will help to cover the copay cost for individuals seeking treatment who don't have that assistance, to help prevent that barrier from being a barrier.
Yeah. Don't be afraid to ask for help.
Absolutely.
Thank you so much, Ketra. Some really good advice. Thanks for joining us.
Thank you.
Thank you for joining us for WGAL 8 in Focus. For all of us at WGAL, I'm Susan Shapiro. And join us again next Saturday night at 7 o'clock for WGAL 8 in Focus, right after NBC Nightly News. And you can watch each episode of In Focus, plus WGAL's latest newscasts, original programming, and more. Just download the Very Local app and stream for free on Roku and Amazon Fire TV.